Hello, it's Dr. Rhonda Johnson, and today is Thursday, March 25th, 2021. And here we go again, folks. New infections continue to rise after a decline in cases for a couple of weeks. Now, nationwide, the number of people who are infected with COVID-19 continues to rise. Nationally, we've seen a 4% increase in the total number of infections just in the past week. And experts are attributing this in part to large numbers of folks getting together without their mask and the more transmissible variants of the SARS-CoV-2 virus. So, what do we know? That the experts, even though they're saying the numbers are about 4%, researchers at Columbia University have joined the CDC in publishing data that suggests that the actual number of cases, that means people who are newly infected or remain infected, is likely 10 times the official day's number of reported cases because the number of folks who get tested is so low. So I know that was a lot of technical language. So translation and common speak. There are a lot of people who are walking around with this virus who don't know that they have it. And these folks who are walking around with a virus who don't know that they have it are contagious, and they're transmitting the virus because they don't yet have symptoms. Now, there may be some people, sadly but true, who know they have COVID, who refuse to quarantine and are infecting lots of people. So, here in the United States, these researchers believe now that just over a third of the U.S. population, around 120 million of us, have now been infected with this virus. Which leads me to a favorite subject of vaccination. You all know that I'm a big believer in getting folks vaccinated against the COVID-19 virus. Now, it's interesting, in this past week or so, Krispy Kreme announced that they would be giving out free donuts to people who get their vaccines. And here's my take on it. If it takes a Krispy Kreme donut to get people vaccinated, then let's give out free Krispy Kreme donuts. Which brings me to another topic. For those who are still on the fence, because again, 80% of Americans haven't been vaccinated yet. What would motivate you to get vaccinated if you're still on the fence? Do you need an incentive? And what type of incentive do you need? Now, some employers are already offering incentives. Kroger announced, that's a large departmental grocery chain in the Midwest and South. So Kroger announced that on February 5th that they will provide a one-time payment of $100 to all of their associates who receive the full manufactured recommended doses of the COVID-19 vaccine. And Amtrak, the passenger rail system, is given 2 hours of paid leave time for its employees to get vaccinated. And it will grant up to 48 hours of excused absences for employees who get their vaccines who experience side effects. Aldi is a grocery chain. They're covering all costs associated with vaccine administration and providing employees with 2 hours of pay for each dose administered. Now, I know a lot of employers are investigating all their legal questions around offering incentives, so stay tuned for more news. And your employer may be offering incentives for you to get vaccinated. I would love to hear your thoughts on this. Topics about incentives, your comments. So I hope you'll leave me a comment on your thoughts. What would it take for you to get vaccinated. So I began this message with here we go again. Infections are rising. I know people have pandemic fatigue, and we have a lot of governors across the United States who have already lifted mask restrictions for political reasons, certainly going against public health recommendations. Now, I have always used the modeling that has come out of the Institute for Health Metrics and Evaluation at the University of Washington in Seattle for my COVID numbers. I use those, and I use the Johns Hopkins numbers, and I use the CDC numbers. But the University of Washington now is forecasting an additional 200,000 deaths from COVID-19 nationwide here in the United States through June 1st. This pandemic is far from over, folks. The thought of another 200,000 people dying is just awful. It just is. We already have over close to 550,000 people who have lost their lives from this pandemic here in this country, and more than 2.68 million people worldwide. Folks, please get vaccinated as soon as you can. And other important prevention tools that you have, don't stop. Please continue wearing your mask, watching your distance, and avoiding large indoor crowds. And if you've got pandemic fatigue and you just have to have people over, you need some kind of event to go to, do it outside and have smaller numbers of people. And wear your mask as much as possible. And have individual portions of food that you're serving. Don't do the buffets. And make sure that people have plenty of hand sanitizer and hand washing stations. We still need to continue to do everything we can to keep our loved ones and ourselves safe during this pandemic. And that's my message today. This is Dr. Rhonda Johnson. As always, my views are my own. Stay safe, folks. And as always, have a blessed day.